So can you resolve Lyme disease, or is it going to be something that you have to live with forever?
In reality, those people are basically cured. Now, did they have some susceptibility? And if a catastrophe happened, could it start to come back out? Yeah. But then could we begin to just redeploy these therapies and they get better? Yes.
Dr. Matthew Cook, thank you for joining us today.
Oh, I'm delighted to be here. Thanks a lot.
Today, we're going to talk about ozone therapy. And this is a fascinating topic. I've heard about ozone for a while, but I don't know a lot about the benefits and how it's utilized. So could you elaborate a little bit more about ozone therapy, please?
So ozone therapy is a therapy that's been around for a long time, and it's the regulated normal medical therapy in a lot of places in the world, including Germany, Russia. There's more and more physicians like myself that are beginning to use it as part of our therapies because it's an amazing adjunct for helping people with infections.
So you're using it for infections. What kind of infections are you talking about?
So ozone is antiviral, antibacterial, antiparasite, antifungal. So all infections that can affect us, ozone can be helpful for. Ozone is a gas, and so someone can do an enema of that gas, and some of that gas gets absorbed into the body, into the bloodstream. And particularly, for example, if they do an enema, a lot of that will be preferentially taken to the spleen and the intestines. And the liver. So it can be a nice way to get ozone there. People can do insufflations in other areas like the nose and the bladder. The people can do injections with ozone. And so ozone can be injected into joints, into connective tissue. People that have chronic infections, you can actually inject into the area in the skin where the infection is. And it can be quite helpful in that setting. And then there are some ways to do IV therapy with ozone. And there's one important way that I strongly encourage everybody to not do, and that's called DIV, or direct IV, where ozone's injected, the ozone gas is injected slowly into a vein, which is not a good idea for about 150 different reasons. But the way that it's done IV is that some blood is pulled out of the body and mixed with the ozone gas and then put back in.
How does that benefit the body? I mean, when you're doing it that way, it doesn't cause a problem?
So ozone fights infection, so it's antiviral, antibacterial. It seems to cleave the sulfhydryl bonds that a lot of bacteria use to attach onto your cells. So it cleaves those, and it makes it so that the infection can't actually do what it's trying to do. It can also just directly kill some infections because they don't have the reductive capacity to deal with the oxidative effect of the ozone.
Sorry for the interruption again. To find out more about this speaker, become a speaker on our show, have Dr. Carter present at your event or podcast, learn more about coaching, consulting, tissue allografts, exosomes, supplements, legal help, or how to create $1 million business card and dominate your area, we're here to help you. Just text your name and any question to 561-962-1231. Write that down. That's 561-962-1231. Or go to our website at drrosscarter.com to learn more. On with the show.
Ozone can be helpful for chronic fatigue and low energy situations. The people who I'm thinking about for ozone are primarily on the infectious side. If you imagine, for example, Lyme disease, there's an overwhelming amount of bacteria and viruses and other co-infections and parasites that are affecting the body, and then having a cascade of things that happen because they're there and blocking detox and doing what they do. Option A is to give people a series of antibiotics to try to kill those bacteria. Mm-hmm. Option B is to do something natural that has an antibiotic effect that can begin to kill those things. And ozone is by far the best thing in that category. I have seen interesting improvements of some people with autoimmune disease, yes, because ozone seems to modulate the immune system, similar to exosomes and some of the other things that we use. Ozone also can be helpful for some people with neurocognitive and neurodegenerative problems. So we see a lot of people with mold. We see a lot of people with Lyme. We see a lot of people with chronic viral situations and chronic GI problems. And I would say 85% of people with neurocognitive and neurodegenerative things will have one of those four things, if not two or three.
Gotcha. So it's usually a approach that you use it in combined with other types of treatment. Is that?
Exactly. If somebody is chronically infected and they've got big effusions in their knees, we'll put the ozone gas into their knee. Okay. And for that population, it's maybe it's a life-changing thing.
So can you resolve Lyme disease, or is it going to be something that you have to live with forever?
In reality, those people are basically cured. Mm-hmm. Now, did they have some susceptibility? And if a catastrophe happened, could it start to come back out? Yeah. But then could we begin to just redeploy these therapies and they get better? Yes. If you want your doctor to learn how to do this, tell them to call us and we'll train them. We'll teach them how to do everything that we do. And we teach people how to do it in a safe way. And we're passionate about spreading this information out to the integrative community and anybody else that'll listen.